During massage, the sense of taste is not something that immediately jumps to mind. However, it does have a big influence when we speak about massage. Taste is a very important element of bonding, and that's why in our infant massage classes with the International Association of Infant Massage, we allow parents to feed their babies when it's necessary. It's quite okay to stop the massage, feed the baby, and then continue when the baby is ready to continue again. We also use an unscented oil during massage. We have spoken about oils and unscented oils previously, but we also say that our general rule of thumb is if you are prepared to put it in your own mouth, you can put it on your baby, because the baby will at some stage start sucking the hands. When they're a little bit older, they might even suck their toes. So we want to use something on the baby's body that's safe for them to ingest. So they will be tasting the oil in any case when they are sucking their hands.
I also include feeding as part of the session. It doesn't trouble me at all. Sometimes people are worried that they need to time the baby's session around feeding and so on, but in fact the feeding gives a lot of information to me about the baby. And even going a step back, one of the main reasons people refer babies to me is related to vomiting, colic, crying, and struggling to pass wind. And so often the parents tell me in a lot of detail they tried this formula and that formula and all these techniques, and those are all appropriate, but my interest is in the connective tissue of the digestive system and the throat. So connective tissue is where we saw trauma, and if a baby's had a difficult birth, or even not, if there was a moment in the birth that was difficult, or the parents were very frightened, often imbalances in the gut show up. By using the gentle technique to unwind tensions over the stomach and the intestines, very often the baby's ability to feed improves amazingly, and they don't need to keep changing the formula and the feeding techniques. It's about how the body is receiving the food. Very often babies have a kind of a twist, a neck twist or a shoulder twist, or tension through their diaphragm, which is the muscle right above the intestines. A twist in the diaphragm means that the intestines have a twist too, and therefore obviously it's very difficult to digest. So we free up this back, we free up the spine, we free up that little pelvis and take the tension out of the pelvis with a very gentle technique. And suddenly the quality of digestion changes completely. And that's how we incorporate this kind of therapy. Colic is not related to digestion only. Taste is not related to eating only. It's an integral part of how the brain interacts with the environment, and again how the baby's body and cues are giving us information about their experience. There's no need for babies to struggle with winds, colic, and vomiting if they come from tension in the bodies. Maybe you could say more about digestion and discomfort and massage.
Yes, thank you. Absolutely. We also teach parents techniques, how to relieve some of the discomfort in the digestive system. We never want parents to think that we do massage with the baby only for therapeutic reasons, but we do, of course, everything that we do has got a specific purpose. And we teach specific strokes on the tummy to help with digestion for babies who are a little bit windy, constipated, or even crampy. We have a special colic routine that we teach to parents. We call it colic routine, but we find that this often brings a lot of relief in the digestive system. Also, by doing regular massage on the digestive area, we are bringing more blood to the digestive area, and the blood carries the oxygen which the muscles need to be able to do their work. So even if parents can start massaging their babies a little bit earlier, before all those problems start, we can help the digestive system to reach maturity a little bit earlier as well.
So it's really a matter that digestion is not just about what goes in the mouth, it's a whole system, and there's a lot that the parents can do to make small but important changes to set up a healthy digestion for life. I personally don't accept this theory that parents get told of, oh well, it'll pass, or leave them to cry and at 6 weeks it'll miraculously go away. There's no reason for people to suffer. We look at the underlying cause, we look where the tensions are, we look where the imbalances are in the digestive system, and we address them so the child can go on to live a happy, healthy life. And we don't have kids in primary school and high school who have all these taste aversions and inability to have different kinds of food. Let's sort it out at the beginning. Build that foundation again through the sense of taste.
Exactly. And that's also why we teach the parents to do the massage themselves, because this gives them a tool to be able to help the baby in the middle of the night, whenever they need to do a little bit of massage. And it's important to note that these things can also be carried on through later life, as Julia said about these kids going to school. Even then, parents have the ability to massage their children and to be able to bring relief when they have little problems.
Yeah, the sense of touch, isn't it so? Who doesn't like a hand on the shoulder, a hug, that comforting hand squeeze? This is what we're starting, and we're willing to work with parents to show them how.